All right, everybody good? All right, everyone, thanks for coming to Inservice. My name is Dwight Blakey, obviously. My title is A Comprehensive Framework for Postpartum Athletic Reintegration, a Woman's Guide to Return to Sport. So, introduction, the female athlete. So, what is a female athlete? For this purpose, a female athlete is anyone who has been exercising in any capacity before pregnancy has begun. So whether it's your just person that goes to the gym twice a week, your professional athlete, your amateur athlete, the one who goes to just run every other weekend, someone who's consistently athletic and consistently doing sport type things throughout their life. So with this, we have to develop a team for postpartum athletes. First, coach. Most athletes, professional, amateur, have some type of coach that they are affiliated with their team or their individual sport, or even in the gym they may have a trainer or something like that. So also have a personal trainer or a performance coach with strength and conditioning that they may affiliate with throughout their team. Postpartum, obviously, you have to deal with a medical doctor, the person they see weekly or monthly checkups to determine their level of fitness, to determine their level of health that they have to inquire from their physical therapist, whether it's a pelvic floor specialist or just their regular physical therapist that they see for musculoskeletal issues. That is an essential part of the team, as you may know, because that's the person they have to see, refer to for the other type of injuries they may have or anything that may develop postpartum. Key person, sports dietitian or a regular dietitian. They will play a critical role in development of the baby and development of them when they're returning back into sport, because there's a lot of things that I'll show you later that develop or may develop if their nutrition is not proper and returning back to that active lifestyle, especially when the world is telling them to get back into sport really quickly. Chiropractor can here and there, depending on their levels of low back pain or thoracic pain they may experience throughout their pregnancy or postpartum. So that's a big part of this is basically their team of who they need to see and who they may see during their pregnancy, after the pregnancy. So physiological changes of pregnancy. The biggest thing is cardiovascular. During pregnancy, have increased cardiac output and blood volume. That is to give blood to the baby so that they can create enough oxygen, or take in enough oxygen so that the baby can get it, because they're breathing for two people, not just one. Increased heart rate, that also comes with increased cardiac output. Just making sure that pressure is good with the increased thermoregulation, so that they're not too hot, that baby doesn't get too hot in there. And that is, like I said, that's the key thing, keeping that blood circulating and flowing as the baby develops from 0 to all the way to 10 month stage when they finally come out. Respiratory changes. Increased ventilation, oxygen consumption is a big thing with the changes in pregnancy that they will have to deal with. Usually that's good because it helps them regulate their oxygen levels better, but that can also come with hyperventilation and everything like that can also be a problem if it gets too bad, according to research. Reduced residual capacity. So that's really just because of the baby, the diaphragm is placed upward now. So now they can't get enough, they're not breathing deeply enough. So that's something that you have to work on and have them make sure they notice when you're developing them back postpartum and when they're going into return to sport. Musculoskeletal changes. There's a lot of that when you're developing a baby. Obviously, you start to compensate, your body starts to compensate. Biggest thing was ligament laxity in the hips, and the low back, knees, feet, ankle, even around the shoulders. There's a lot of ligament laxity that you may think that can cause injuries while they're pregnant that they may not notice because they just think it's pain to their baby, or postpartum when they're trying to recover that they may have noticed during the pregnancy that can trigger something else. Increased weight is a pretty obvious thing. They have a baby, they're eating more, they're trying to eat more to compensate for the baby. Increased nutrition. Another big thing is shift in center of mass. So now that they have the baby, they'll be probably leaning forward a little bit more, so their center of mass will have changed. And they probably, like I said, another thing they probably won't notice but that will cause muscle tension and stretching. Sometimes they may have tight muscles, but it's not because it's like too tight. Sometimes because overly stretch and tension is placed on those muscles, mainly hamstrings, abdominals, because they're trying to compensate for the anteriorly shifted pelvis that is taking place when the baby is developing in the womb. And then finally, for musculoskeletal changes, increased pelvic floor pressure due to the baby pushing down on their pelvic floor, and then having to compensate and having to adjust with their body to accommodate this growing child. So postpartum, what's where we come in, building strength, confidence, and health. Physiologically and psychosocial. So the biggest thing we see with postpartum is decrease in bone mineral density, because they're taking the baby's taking all their calcium, not all of it, but taking a lot of their calcium, and through breastfeeding. So the baby's the food that they're eating, the diet they have, so it has to be increased to compensate for that baby taking a lot of their calcium. So a lot of times you see stress fractures when they're returning to sport, especially in long distance aerobic athletes, because of that decrease in calcium, their bones are not being developed as strongly as they were before the pregnancy. So you see a lot of that sometimes, which calcium obviously is crucial for the baby's development. So that is a big thing that we see with that. Pelvic floor dysfunction, whether it's C-section or natural birth. Obviously, natural birth will create more of a thing you have to work with, because the vagina is being stretched apart, and 15 to 30% of women postpartum have a urinary incontinence. So sometimes they just pee on themselves and things like that. So when developing the pelvic floor muscles, well, I'll explain that later. That's a big thing you have to worry about. Rectus abdominis diastasis is when the rec abs are stretched far apart during pregnancy, because obviously the baby is growing in there. Sometimes it will create a bulge that may last postpartum for months, sometimes a year afterwards, if not corrected and worked on. Low back pain, like I said before, you're compensating, so you're anteriorly shifted a lot, so a lot of people will have low back pain, and that may be hindering their performance postpartum. Sleep disturbance, whether that's pain, ligaments, pain and muscle tightness, pain with low back, and also like the disability to sleep, because the baby's waking up every 3 hours or every 4 hours, or whatever time the baby wakes up. And then if someone doesn't have a partner that will help with that, sometimes they're not getting the adequate sleep that they need to help develop their training regimen so they can get back into their return to sport, or even just developing properly so to help the baby out with necessary care. If they do have the partner, it does help, but then again, sometimes the partner needs to go back to work, whatever the case may be. So the sleep is a crucial part that will be lacking. Mental health and depression. A lot of people know postpartum depression is a big thing. I think it's 25 to 80% of women can have postpartum depression. We're not going to get too deep into the postpartum depression, because that's something that you want to refer out to, because that's not like our scope of practice. But it is something you want to consider and take into care when you're dealing with somebody, working with somebody that's a postpartum athlete. I'll get into that a little bit later as well. Newborn care. This is where we can also develop injuries, musculoskeletal injuries. Holding the baby, carrying the baby, transferring the baby, playing with the baby. The way they sleep, the way they go about their day. Because even when they're sleeping, they're always kind of awake, so they're tense. They're worried about if the baby coughs wrong, the baby moves wrong, they make a noise while they're asleep. They're always moving around. So the parent probably may adjust their body to sleep a different way, or hold the baby in a chair a different way, so that it will cause musculoskeletal pains. And then societal pressure is probably one of the biggest things. For the amateur athlete, or for the athlete that's just the gym goer, societal pressure is a big thing. When do you come back to work? That's a big thing that we see. When do you come back to work? How soon will we be able to get back to work? That's something that the mother will be thinking about a lot. Other children, if they have older children than other children, other than the baby. They have to take care of those children as well as trying to get back into work, as well as trying to take care of the newborn. Big pressure that they have, and it's something they'll also be constantly worried about. And then their fitness level, especially for the premier athlete, tennis players, track runners, after they've had a baby, when can you get back? When's your next tournament? When's your next event? When's your next race? The pressure of getting back into that level of competition is key and important for their life and for the life of their family, for the life of people around them, their friends, and even for people who are just amateur athletes getting back to playing tennis or playing whatever sport they play with their friends, their family. A big challenge that they have to face and overcome, because people are going to wonder, are they going to be able to get back to their level? How successful were they in their sport? Their gym goals, their gym gains. Do they want to get back to the body they had before? That's the body they had before. I'll explain that later too as well. It's just pressure that they have and put on themselves to get back to those levels that society kind of puts on you. All right, so understanding the psychosocial, like I said, postpartum depression is a big thing. And here, as physical therapists, these are 2 questionnaires and surveys that you can use. But if you guys get the PowerPoint, the link is in the PowerPoint, so that you can use that. If you have any athletes who have just had a baby, here's postpartum depression scale and patient health questionnaire, and it helps determine the level of depression that they may have, so that you can work with them accordingly, refer out to psychologists, sports psychologists, MD, so that you can work with them in the proper way, so that you can develop their plan of care. Because that will also impact their visits, that will impact the way you treat them, that will impact their mood when they come in. So that's something you definitely want to look at when you have to deal with a postpartum depression athlete. So phase 1, biggest thing, this is the most important phase. Phase 1, recovery and healing physiologically and gynecologically. You can start this as early as 2 weeks, as long as they're cleared by the MD. A lot of people think that we have to wait months and months to get started back in that fitness, but that's actually not the case according to research. Exercise has no adverse effects on breast milk, so destroying that stereotype when you get them into the clinic, and they're going to think that maybe I shouldn't be doing too much, maybe I should be doing this and that. But you have this plan, you have the details of what they should do and what they can and cannot do. So kind of destroying that very stereotype that they cannot be exercising, they can't be doing anything, because they can, as long as they're cleared by their doctor, they can do anything to it. Scar management, working with the scars, making sure that they're healing right, everything like that. Big thing. Body mechanics for baby lifting, sitting, holding, and breathing. Like I said, they can develop injuries, musculoskeletal injuries, through holding the baby wrong, leaning in the chair wrong, laying down wrong, because they wouldn't take. All they think right now is about the baby. They're not thinking about themselves. So I want to make sure they're holding the baby right, creating good posture. That's a big thing that you want to make sure they're not developing any other type of injuries as they're going along. Squeezing technique, that's the pelvic floor technique. Make sure they're squeezing, make sure they're holding. This can be this is more about motor learning, motor control, local muscle type of thing. So this can be developed through the hips, through the glutes, through the abs, through the low back. All your motor control cues that you kind of learn in school, this is where this comes in for postpartum women, and make sure that they develop that as we go through the different phases of exercise. So they actually have controlling that weight with controlling those holes with activities of daily living, English. Being able to walk, sit down as they squeeze, so that they control those urinary incontinence that may have developed through the pregnancy. Creating good posture, standing, walking, like I said before, walking around with the baby, sitting in the chair properly. All good things that we need to make sure we tell and inform the parent on, because sometimes they may not be thinking about that. They're thinking about the baby all the time. Walking gait assessment, developing a walk gait assessment, because now they have a new normal now. They've had a baby, they've developed for 10 months, 8 months, 9 months, however long it's taken. So now you have a new normal of your walking gait may be different, your ligaments may be different. So you have to be able to correct and see that, so that they can develop properly and return back to that level of performance that they want to be at. And obviously biomechanical assessment, determining their level of function with how are their muscle firing. Is there a local muscle problem? Is there a strength issue? Are their nerves firing properly? Everything like that. So, not to go too deeply to this because the MD will kind of notify, but these are a few things I highlighted that are something you want to look out for when you're dealing with a postpartum athlete. Blood pressure 140/90. Make sure you're doing their blood pressure when you come in for a visit, because you never know, it may not present as that, but it seems like, as we know, in cardiovascular classes, like you learn that it can be high and things of that nature. Onset of angina, chest pains. If they have any chest pain that they have, you don't want to just ignore that just because they've had a child. Like, there could be something going on secondary with that, and you might need to refer them out. Severe abdominal pain, also something that you want to check on. Like I said, with the diastasis rectus, you might want to make sure they refer out to a physician if they have severe abdominal pain. Systemic infection with fever, swollen lymph glands. You also want to refer out for that. If they have any of those issues, and a loss of consciousness for any reason, you want to stop exercise, refer them out to a doctor immediately, because you never know what secondary condition they may have. All right, phase two. Phase two is starting with controlling that squeezing technique. That's what I talked about earlier. That squeeze technique through everything. We're starting to get more functional. We're starting to lift weights. We're starting to make sure we do functional activities so they can develop those muscles, develop those local muscles as well, and starting to integrate aerobic activity back into their daily regimen. Wherever, if they were just amateur athlete, wherever they were before, you want to get them as close as you can back to that level they were at. Informing them that they are now a new person, they're no longer the person they were before, is a key thing too, because a lot of people would think that, I can get back to that level I was at. You can, but now it's a new process of getting back to that level. You will not be the same that you were. Your body has physiologically changed, and now you have to make sure they understand that. And the biggest thing understanding that is integrating that program where we're holding while we're doing a lunge. We're holding while we're squatting, or squeezing while we're squatting. Like I said, another biomechanical assessment as we've gone through that phase one and seeing now how much strength can we handle, how much weight can we handle, what does their running look like now? If they're an athlete that needs to run in their sport, what does their gait look like now? We saw walking before, but walking and running, obviously, we know is two different things. So we want to see how they run. And pelvic health assessment, make sure they're referring back to their pelvic health specialist, their MD, or if you're a pelvic floor specialist, make sure they're seeing them as well, so that you can communicate with each different person, so that we can develop a solid plan, so that we can best develop the athlete to get back to where they want to be. And monitoring just based on the training goals. What are their training goals? Were they amateur athlete? Were they working out 3 times a week? Were they working out 6 days a week, playing an Olympic sport? You really want to know where they want to be and have those talks with them as they develop, so they can understand like where they can be, where they want to be, and how you can help them get there. Understanding constant communication between the team that I talked about earlier and then the actual patient is very critical, because you never know what goals or ideas might change. Will they want to retire now? That's another big thing. Retirement, because they may think, I can't do it. Obviously, there's just a list of people, Serena Williams being the biggest one right now, who have got back to that high level performance. It's just showing that they can do it and being communicative and open about that. All right, phase 3, plyometrics, jump rope, skipping, ladder, jumping. Same thing, holding that squeeze while they're doing that. You want to make sure they are squeezing while they're doing that, as well as informing that during their activities of daily living, because it is very important that they have that local muscle control, especially with the pelvic floor health, so that they can handle that. Sometimes there might be pain still down there. So if something is too much and just having too much pain with it, regress. Make sure their program is like planned out in advance. It's not something you want to just like, all right, we're going to try this today. You want to make sure it's developed based on their prior level of function from the previous session, because things don't develop as quickly as ankle sprain. This is it may be other underlying factors, especially with them holding a child all the time, living with the child. Like I said before, they have other children. There's a lot of different things that take into factor when you have a child now. Increasing aerobic capacity for sports training. This is where you want to start ramping them back up to where they were previously at. You want to get them as close to playing speed for aerobic capacity as you can. And start developing a little bit into the skill work, making sure our workouts are functional, and building that power. Start doing Olympic style lifts if they are that type of athlete. If they're just a 3 days a week gym person, you probably don't want to ramp like that. You want to get back to, like I said before, their prior level of function, and then doing advanced strength training for, like I said, whatever their goals are. You want to make sure those goals are set so that you can develop the proper plan for the strength training, the power, aerobic, and then the plyometrics. And then sports specific. I just want to take the time to admire women in sports. Track, cross country, volleyball, softball, flag football is a big one now. CrossFit, dance, gymnastics, cheer, Olympic lifting, basketball, ice skating, lacrosse, Pilates, swimming, diving, tennis, and skiing, and obviously there's much more. But as a oldest of 5 sisters, I love watching women's sports. I love promoting women's sports, so I'll take this time to do that as well. And learning this information has really gave me a new knowledge for what a lot of men don't see or don't know. As women obviously know, because they develop, they want to know more about what life is like when they have a child. But taking time to admire women's sports and give credit to what they have done and what they have accomplished to get there. With that being said, developing sport-specific return to sport programs. I have a return to run program that I was given during CSM. It's really good. Also developing sport-specific drills based off the sport that they play, whatever that may be, or even if it's just like amateur. I go to a run club once a week, once every 2 months. Developing that, getting them back to the point where they can enjoy and be happy and not have to worry about being in pain when they're getting to their sport, when they're getting to their gym, whatever the case may be. If they just like to just walk, developing those attributes, developing that strength, developing that return to sport program that will help them be at the level that they want to be at. Mental and emotional support. Like I said, a big thing, making sure you're talking to the team, the doctor, the MD, the pelvic floor specialist, dietitian, their coach, if they have a coach, their trainer, their personal trainer, or strength and conditioning coach for their sport. Making sure you're talking to everybody so that you guys are all cohesive and understanding what you guys need to do to get them back to where they need to be, or in their goals. Like I said, make sure their goals are realistic. Make sure they understand that you are not the same person. You are now your new normal is something different, but developing that mindset that you can still be where you want to be just because, even though you had a child. And make sure you involve the family. Make sure you let the family know as appropriate how they can help the mother go through these challenges, whether it's the grandparent, the older brother, the cousin, the father, the husband, whatever the case is. Make sure you involve the family. Like I said, I don't go too deep into the postpartum depression because that's something you really want to refer out to. I gave the questionnaires that you want to look at so you can understand where they are as far as postpartum depression, as where it can help you. But just make sure you refer out if you're starting to see signs of postpartum depression, and make sure you're open to talking with them. You're still a therapist, even though we're physical therapists, you're still a therapist. Make sure you understand where they're going through, the things that they might be struggling with, so that you can help them in the best possible way, even if you're just being a kind word, being a friend to them. All right, prevention. Red S. This is one of the most common things for women in sports. 25 to 80% of women in sports can develop red S. It comes from poor diet and health. Yes, women that are not even have not had a child. You get low energy availability, LEA, which is really the cause of red S, through the diet. And you're starting to notice this in fatigue. Why is my player so tired so fast? Decreased bone mineral density, frequent stress fractures are a cause of this, and it's not just the calcium, it's just your body is trying to absorb some type of nutrients, and your body takes from muscle and bone first when there's a lack of nutrients. So poor performance, poor recovery, you'll start to see a decline in their performance. If they're a weightlifter, they won't be able to lift as much. If they're a sprinter, they'll start running slower. If they are, hockey, they won't be hitting the puck as hard. A lot of different things for whatever different sport has developed through that decline with red S. The menstrual cycle, it's another big thing. Do they have irregular absent periods? And be asked this in a comfortable way, especially for the males. Start to develop those questions when you're working with women in sports. How are they feeling? How often are they having regular periods? Because this will also determine your level of care and if you need to refer out or not. Amenorrhea is what it's called when you have irregular absent periods, and then primary amenorrhea is 1 to 2 months, but secondary is 3 to 6 months, and these can be life-threatening issues. So you definitely want to refer that out. If you talk to them, they feel like something's going on, I'm not feeling okay, they don't feel like talking to their doctor, you want to make sure you refer them out to them, because somebody needs to work with them, and if they have red S. Like I said, it is very prominent in women in sports. The treatment and prevention for this is referring them out to also a sports dietitian or a dietitian of like a professional athlete, because they need to increase their caloric intake. Also, they need to develop their hormonal balance, because their menstrual will be thrown off with a lack of, with the lack of the menstrual cycle. You also want to decrease the training, because with that fatigue and that lack of nutrients that they're receiving, that their body is more subsequent to injuries. And here's also a PDF I have attached to here where it's a scale of determining red S, and it gives you all the breakdown of what you need to know for red S and determining if a patient has red S or not. Next big thing, that injuries that occurs with women in sports, this is more postpartum, but it also occurs in regular athletes, men and women. Rhabdomyolysis, which is intense training, which has caused a lack in muscle. So the clinical triad for rhabdomyolysis is severe muscle pain, weakness, and tea-colored urine. I've heard about urine being as light brown all the way to black. If someone's saying they're peeing black or peeing brown and they have no injuries, nothing happened, but they have increased their training out of nowhere. If there's someone who was only working out once a week and they're trying to do a challenge, and now they're working out 6 times a week, and they're saying any of these 3 things, that's something you might want to check for. Same thing if they're a professional athlete, they're taking a break, and then out of nowhere they're like, all right, let's go back to how I was. I've taken a week off, 3 weeks off, and they return back up, and they've had any of these symptoms, you want to check and see if they have rhabdomyolysis. Send them to their physician. I had a teammate personally, well, not teammate, but a friend who went to my school who was an All-American, took 1 week off of training, returned back to training at full speed, and developed rhabdo for a month and a half. And so it can happen out of nowhere to anyone. So diagnosis really confirmed when you go get blood testing with the creatine kinase levels. It's usually 5 times the normal limit. Don't allow it to be confused with DOMS. If it's stored for too long, that may be a clinical reasoning of rhabdomyolysis as well. For women postpartum, it can happen with prolonged labor. How may you ask? Because the squeezing, if you have prolonged labor, you're squeezing for a long time, you're breathing, your body's intense. This is almost the same thing as lifting for a very long time. Those saying the blood pressure is up, the heart rate is up. This can also develop rhabdomyolysis. It's not common, it's actually very rare, but it is a possibility that can happen. So also, like I said, the spike in training, if you are pushed into the training phases, if you're not developing the training phases properly, if they're developing the training is going too fast, you can also develop rhabdo from that spike and increase in working out. A lot of people, most people do not work out as hard as they would without being pregnant. So that decrease in training and then that increase in training can also cause issues and also cause rhabdomyolysis. So like I said, societal pressure for the professional athletes could impact that, and they want to get back to their level as quickly as they can. If they have an event in 6 months and they're like, I have 4 months to get ready and then 2 months to train for a sport specific, and they have that pressure from society and from their people, their peers, their coach, their agent, whatever the case may be, to get back to that, and they don't want to lose the opportunity to make money to help their family out. And also unusual training. If you go from just doing regular weightlifting 5 days a week to now doing CrossFit training, where you were just a sprinter and now you're doing 15 miles, you can also develop rhabdomyolysis, because it's the unusual training for your body. Your body's not used to that. It may not be able to handle that capacity. You may be able to do it, but to consistently do it like that in that way can also cause rhabdo. So prevention and management for rhabdomyolysis. You want to slowly increase exercise, like we talked about earlier. You want to phase it out, especially for postpartum patients. You want to phase it out to develop and ask them how they're feeling, and ask them how their whole cycle is going for postpartum, and make sure that talking to that team, those doctors, the pelvic floor specialist, their coach, trainer, and also their family members, how are they acting as well. Consistent hydration and nutrition can help prevent rhabdomyolysis. Make sure they're eating properly, make sure they're getting that nutrients they need, and then pee monitoring. You want to make sure that they're looking at their pee as they're developing back into sport, because if they're training too hard, like I said, you'll never know sometimes what they're doing outside of the trainer that they're working with, outside of their coach, outside of working with you as a PT. They could be doing more at home, and that increased exercise could detrimentally impact them. And rhabdomyolysis could cause death if gone untreated as well. So I want to take the time to say thank you guys for listening. I hope you guys learned something today. I like to say, stronger postpartum, limitless always. Don't let them limit themselves based off where they can be. They can still be that high-level athlete when they're done. Once they had a baby, it's just making sure that they develop that, and they know they're not the same person they were before. They have a new normal, but it does not mean that they can't be all world, all country, all 2 days a week gym, if that's what they are. My name is Dwight Blakey. Here's my email, and that's also my LinkedIn. Find me on LinkedIn. So thank you. Any questions?
When you're talking about squeezing, are you talking more about like transverse abdominis? Are we talking like TA set, like oblique? What kind of squeezing, holding?
So when I say squeezing, like there's pelvic floor technique where they squeeze until they squeeze their vagina and their internal.
Like Kegel based?
I do not know the term Kegel per se, but they also have weights they'll put in, and they have them squeeze and hold, and that will give them like a cue, so they know what you mean when they say squeeze. So I have them like pelvic floor specialists will help them put the weights in, and they'll squeeze, and they'll transverse abdominis as well too. That's part of it. They'll have them squeeze, and they'll have them walk around, or they have them just hold the weight, so they squeeze so it doesn't drop, and that way they can get used to feeling what that feels like, so that they would go throughout their day, make sure they're walking around squeezing, which that phase one thing. And then when it's time to start going into phase 3, they can jump and still squeeze without having to worry about anything like those hips dropping, or the pelvic floor areas not being tight, because they will start to develop pain if they start to jump or run or put too much pressure on it, and that's not something you want, especially going down the line when they're returning to sport.
What kind of timelines did you see when they talked about postpartum to any type of full return to sport? I know obviously there's a big variation.
There's like I said, there's the pregnancy determines a lot of that. So how was it a C-section? Was it natural birth? Was there a complication with the child? Was there a complication with the mother postpartum? So that determines a lot of that. The earliest I saw in the articles I looked at that talked about just professional athletes, I think it was 5 or 6 months return to sport, return to competitive tournament sport. I think it was a couple tennis players. I've seen a year out. think Shelly Ann Fraser-Price, I think she's a Jamaican sprinter. I think she ran 7 or 8 months after. She didn't get like first place again, but then after like a year out after that, I think she got like second or first at an event.
Yeah.
So I've seen as early as 5-6 months compete, winning. Serena, I think Serena won like 8 months after or something like that. So those are top level people, obviously, but it can be done.
Yeah. So you think about like ACL, or gold standards like 9 months to a year, like having right 12, 15 really, having a child. I mean, obviously dealing with the same like strict anatomical changes because of all the laxity and things like that. But like in terms of like return to high level sport, I feel like
definitely has to be closer to that.
And I've seen they like I said they said eliminate that fear. Some people have come back in terms of like lifting weights within a month because they were cleared and they may not have had as many postpartum issues as someone else may have. So it just it depends on when and how long your recovery is postpartum.
Yeah.
So.
In your research, did you happen to see anything that women can do prior to actually having the baby that can set them up for more success?
They said exercising is no problem. Exercising during the pregnancy helps tremendously, especially with the squeezing aspect, because when you're exercising, you go to your specialist. They tell you to squeeze when you're working out, especially squatting, because you're bending down, you're stretching the area out. So they said squeezing while you're working out during your pregnancy will help a lot, especially with lower body lifts. Besides that, I didn't really see a whole lot of other things. They said really just the biggest thing is continuing your normal routines. If you're running before you got pregnant, run during your pregnancy. If you're lifting before you got pregnant, lift. If you're playing tennis before you got pregnant, play tennis. Obviously, as you get closer to the 7, 8, 9 month mark, you want to taper that off a little bit. But the people that have had babies at 9, 10 months who are working out fiercely at 8.5, 9 months and have had no issues based on research and based on people I've listened to at CSF. So, yeah.
Thanks.
All right, no more questions then? That's it.
well done, Dwight.
Thank you, I appreciate it.
Okay.